Hello, everyone, and welcome to today's webinar. We are so excited to have so many of you join us. I apologize profusely that the incorrect link was sent out originally. We have rectified that and sent out the adjusted link, so hopefully we'll have the rest of our participants joining us soon. On behalf of On With Life and the On With Life Academy, thank you so much for joining us today. We know this is such an important topic, and we're excited to be celebrating Pride Month by sharing this webinar on establishing allyship. Given the attendance for today's webinar, close to 100 people, we know how important this is, and we're excited to hopefully continue providing some education on this topic. Some of you have already submitted questions that you'd like our presenters to answer. If during the presentation today you've come up with other questions you'd like them to answer, our presenters are going to stay on the webinar past 1 o'clock to answer some of those questions. So I understand some of you may need to log off right at 1, and that's okay. We'll get you your CE still for that full hour. But if you're able and willing and interested, we are going to have Dr. Logeman and Kim join us for a live Q&A session, immediately following the presentation. So hopefully from about 1 to 1:15 or 1:30, we will be answering those questions live for you. We know that this is a sensitive topic, and we are excited to be beginning to really dive into it here at On With Life. So please take this all with a grain of salt of knowing that we are still learning here too. And we recognize that this is the first page of the first chapter of the first book of the library of things that we could present on this topic. So this is just a very initial presentation with hopes that we will be able to continue this with your feedback on what you would like to see. So without further ado, I am going to turn it over to our presenters. They did pre-record this because they had so much information they wanted to share with you that they had to edit it a little bit and get it down to just over 1 hour. So we will start the presentation. Use the Q&A function if you have questions that you want them to answer, and we'll regroup here after the presentation for the live Q&A.
Hey everybody, welcome to our webinar, Establishing Allyship, What You Need to Know When Working with Individuals Who Identify as LGBTQ+. I'm Dr. Allison Logeman. I'm a neuropsychologist at On With Life.
And I'm Kim Reed, the Training and Development Leader with a background in recreation therapy.
And welcome. Please stay afterwards for a live Q&A session where Kim and I will be available to provide any clarification or help with translating anything that we're talking about into your daily life. So
I also want to mention that we're going to be going through a lot of slides, and there's a lot of information. So if you'd like to request the slides, you can just do that when we're done.
I do want to say Kim is sitting right across from me, so if you see me looking up, it's because we're enjoying ourselves. So all right, this is what we're going to talk about today. Note that, as I go through, or as Kim and I go through this, we're not going to pull these out. Some of these will be integrated in some of the information that we're talking about. So all of these things will be covered. It just won't necessarily be as bullet pointed or as clear as potentially you thought. Okay. All right, Kim, what do you know about the Compton Cafe riots of San Francisco?
I actually know nothing about them.
Okay, so these happened in August of 1966. I'm not going to go into a lot of detail just because we do have a lot of information, but I do think that this can provide a lot of context of where, our history of where things were and how far we've come, and also how far we need to go. So note that there are a lot of resources out there. Some of my sources include definitely Wikipedia, but also NPR, History Channel. They all have really good resources to check out if you're interested in some more of these things. But what you see here are a couple of screenshots from the documentary Screaming Queens, which is about the Compton Cafe riots set in San Francisco in August of 1966. And Compton Cafe was pretty strategically positioned in San Francisco. It was near a bunch of bus stops, train stations, and it was a 24-hour cafe where people, transgendered individuals or sex workers could go, or even homeless youth, homeless persons could go to get a hot meal. But this place was also very prone to police raids because at the time, if you had a gender expression that was different than your ID, it was considered illegal. So it was very frequented, raided by police. And this documentary is about the famous raid of August in 1966, where the drag queens and transgendered individuals actually started protesting and acting out in retaliation of that police raid. So this is one of the very first like protests that actually have become part of the LGBTQ pride and history. So I bring these up to understand the context in which to understand gender identity and sexual orientation through the years. And I think that this is really important, especially when you look at the survey that was done by Ipsos, I think is how you say it. And it looks at how people identify as transgender or gender nonconforming or identifying in any sort of way. And as you can see, the population is actually growing exponentially as you look at different generations identifying as gender, transgender, non-binary, or non-conforming in any other way. And I think it's very interesting because, as they age, we're going to have more exposure to them in our healthcare settings or in whatever capacity you serve. And I think it's very interesting. We especially see this increase in individuals who identify as bisexual. So what's also really interesting is that looking at some of these nursing studies, almost 80% of nursing staff say they were not provided with LGBT patient-centered care training. But when we look at, what they say, it's kind of clear that they don't know what they don't know. The other study done by Tamaro and colleagues found that 91% of providers said that they were comfortable providing care to LGBTQ patients, but only 30% answered basic LGBTQ care questions correctly. So we kind of have this huge discrepancy between, okay, so not a lot of people are getting education on it, but a lot of people say they feel comfortable with it, but yet when we get down to the nitty-gritty brass tacks kind of bench to bedside skills, not a lot of people are able to kind of answer some of these basic questions that are important to LGBTQ patient-centered care.
I think the timing for this webinar and this slide is so pertinent to helping give back to these persons served and even coworkers that we work with. But the persons served that we deal with on a daily basis, most of us as therapists, we're caregivers. We want to give back. We want to provide patient-centered care, person-served-centered care. But if we don't know what we don't know, it's difficult to navigate. How are we going to figure it out? How can I still be very inclusive with them if I don't know that lifestyle? I don't know the way they identify. I don't know the terminology to use. So I think this is good timing to kind of start to walk through that and start the process.
Yeah. So it's like, so you're trying to be inclusive, but you assume you're being inclusive, but because you don't have some of the baseline knowledge, you miss that maybe you're not as inclusive as you should be, or sensitive or attuned to certain things. Yeah. Okay. So to best serve LGBTQ populations, we have to work on our knowledge and competencies in two ways. One is we have to do this cultural competence, which is more about like that semantic knowledge of things you need to learn, those attitudes and awarenesses that you have, basic knowledge, including terminology, and what specific skill sets you need to work with certain populations. Now, we have a very diverse audience, and so I'm not going to be able to talk about what specific skill sets you need. And I think that, this is a really good reminder that this is a starting point in the conversation, and we hope to provide some basic information, but just know that this isn't the end all be all. This is very much a 101, and there are other skill sets that require you to go out and to learn in order to continue to be cultural competent. So that's, again, cultural competence is kind of that semantic knowledge of things you need to know. But then there's this other component of cultural humility, where it's more about a self-exploration and a self-critique while trying to remain others focused, and understanding the dynamics of respect, and the power dynamics and attunement to other people's cultural beliefs and values. So we have the semantic knowledge, and then we also have the process of which we learn and apply that information to the person in front of us.
Yeah. I kind of think of this as competence, exactly what you described, kind of knowing that knowledge, the definitions, the basic stuff. And then the humility aspect is when we're working with our person served, how do we put that in practice? How do we make it meaningful when we're working with each individual, no matter what letter they come from or how they identify? How do we put that to practice?
The other thing that I think is important is we need both, but ultimately we need to shift our focus from competence to humility, right? If we only assess knowledge and proficiency in working with LGBTQ populations, if we only assess competence, we're missing a lot of things. There's this idea of false competence. I'm going to go back to that data where 97% felt confident that they could work with LGBTQ populations, but then only 30% answered questions correctly, right? There's a huge discrepancy there that leads to this false competence. This other idea of measurement issues, where we're not assessing things like self-confidence or implicit biases. The other thing is that we measure competence by things like getting so many things right on a test, right? But that also implants this idea that once you've learned all of the things, then you're done. And that's not necessarily the case, right? Especially when it comes to these social issues, it's evolving through history and through events that are happening now. And so you can never reach a point of complete competence because it's about staying up to date. It's about that continual self-reflection and evaluation and critique. And then we also have this, what we call an ecological fallacy. So it's this idea of if we learn all we can about a population and we get that A on that test, then we potentially erroneously apply that information to an individual. And so as opposed to remaining person focused or individual focused. And so we can make a lot of assumptions based on something that we know or assume about the person, when in reality, we need that baseline knowledge in order to provide a safe and welcoming environment and working with them, but we also need to remain individual focused, which is again that humility approach. Mm-hmm. So that humility approach really teaches a mutual respect for a patient-provider relationship. It's an emphasis on the individual's experiences and identity and expression. And it really focuses on teaching and learning self-reflection. What are my implicit biases? What are my views? What is a lens that I see things through? And then also active listening. It's not about a one-time educational session. It's more about hearing something that they didn't know and maybe tailoring it and tailoring healthcare and tailoring experiences and interventions to the person.
Yeah. When I think of that from a functional perspective, when working with person served, if I would go back to my rec therapy background, I would think of when I'm doing a group with individuals and I want to have a team competition and it's men versus women or girls versus boys, that's setting me up for failure if I have an individual in there that identifies any other than those two genders, those two sexes. And so that's one thing I think of. I think of other functional things, like if you're working in the community with person served, are there gender not or non-gender specific restrooms? Can you go in there with them? Can you make that accessible for them? If you're working with individuals with personal cares, are we giving them the appropriate adaptive equipment for the way they identify, their preferred toiletries, no matter what they identify with? Just even some little things like that to make our treatment and what we're doing with these individuals so much more meaningful and so much more functional.
And all of those examples are really great examples of person specific, focus on the individual. So how do we practice in culturally competent ways? How do we integrate that that competence and the humility. And we can do that in two different ways. We kind of have a matrix going on here, right? We have that surface level, which are the things that people can see, that show that we're a safe working environment. I'm a safe person to work with. And that includes things like languages, both within the culture, when you're talking with colleagues, when you're talking with person served, and forms, right? It can include things like gender neutral bathrooms, like what Kim was talking about. It can include posters, flags, around the office or on your website. So that's kind of like the surface level stuff, and we'll talk more about that in a second. And there's also this deep level, which is incorporating unique aspects of the LGBT plus experiences into your work, both into the content of your clinical practice and the process of your clinical work, and adapting those interventions to meet the needs of the person that you see in front of you, just like what Kim was talking about.
In terms of working on that deep level, I think too, and I mentioned a little bit earlier, but really getting to know a person served and helping someone feel safe, even if it's just asking them about their spouse versus their husband. If one person can make them feel safe, I think that just that will help no matter what point of treatment they're at, whether it's a single office visit, when they're in a rehab setting for 3 months, whether it's long-term care facility. I think those are things that just make someone feel safe and more open to different treatment options, open to different ideas. So those are some of the things I think why knowing the surface level, but really activating that deep level and putting it into practice is very important.
Okay, we're gonna start with the terms on our surface level journey here, and there's a lot of them, and we just don't have the time to go through them, and they're all so interesting. And I'm hoping to use some of the terms as a jump off point for a deeper conversation. But please check out the Trevor Project and It Gets Better. Those are the two websites there, and they have a lot more terms. And I like the It Gets Better glossary because it kind of also groups terms in terms of like sexual orientation and gender identity and gender expression. And so you can kind of see how all those fit together as well.
This really ties in too to that thought of putting it into practice, learning the identifications and learning the definitions to make people feel safe. It's just that next step that we can take when we're treating person served. We are all caregivers. We all want the best. I know we all go into it wholeheartedly with that person-centered treatment option. But if we're missing calling the wrong person the wrong name, or asking where they identify and misgendering them, it's putting us right out of the gate at where we already have negatives against us. So it helps us build chips with our person served or our patients, so that we can get their best function out of them.
Okay, we're gonna start with some general terms. Sex is, when I hear the word sex, I think of biology. And you would think it would be as easy as that, but it's not. We have the binary of male and female, but it's not only based on those external anatomy, it's also combined with chromosomes, hormones, internal and external organs, and secondary sex characteristics. And so even something as simple as biological sex, you can have a lot of permutations of what sex or what sex is or assigned sex. Sexual orientation, I've also seen it be called sexual attraction, is the desire that one has for an emotional, romantic, or sexual relationship based on the gender, expression, identity, or sex of somebody. Gender is an internal state along with an external like presentation or awareness of where one sits on the man-woman spectrum, or if they sit on that spectrum at all. And it includes a couple different aspects, including identity, expression, and also gender roles. And then lastly, sexuality is this kind of all-encompassing term. This is from the World Health Organization, but it includes not only sex, sexual orientation, and gender, but it also includes things like pleasure and intimacy and reproduction. It includes thoughts, fantasies, and it is the term sexuality also encompasses that these things don't happen in a vacuum, right? We experience these things and we develop these things in a political, economic context, which is why, when we learn about LGBTQ history, that context is so important. Okay, sexual orientation. I really want to start off talking about the LGBTQIA. You'll hear Kim and I say that a lot today. And if you look, it's actually an acronym of the words lesbian, gay, bisexual, transgender, queer, questioning, intersex, and agender or asexual. I've also seen the A mean ally, but I think that's falling out of fashion in favor of more of this agender, asexual component. And it can be a little bit confusing because this acronym is not only made up of sexual orientation and attractions, but it's also made up of gender and gender identities. So it's really kind of an all-encompassing acronym. I want to break it down just a little bit more. Queer is identified as, or queer is used as a term for anyone who is not heterosexual or cisgender. Asexual is someone who experiences no sexual attraction or very little sexual attraction to someone. They may be interested in relationships, they may not be interested in certain relationships, or they may have a specific orientation, they may not have a specific orientation. Bisexual means someone who is attracted to the same gender or a different gender or genders. Gay can be used as an umbrella term for somebody who is attracted to the same gender, but colloquially, it's usually used in terms of men who are attracted to other men. And then not included in our acronym, we have pansexual, which is someone who is attracted to a person of any sex or gender. And I think a really positive depiction of someone who's pangender is actually David Rose from Schitt's Creek. This is a clip from season 1, and I really encourage people to go check it out. Like, a whole premise of this show is that, you know, David presents as pansexual, and like this small town in Canada like doesn't make a big deal about it. It's no longer about the fact that they are pansexual, but that they have, you know, relationship difficulties just like everyone else. So I think that that's really interesting.
I like that point too, because I think it helps us remember that although we're learning these definitions of how people identify, that shouldn't be the label that is on their chest or that they wear on their t-shirt. But good for us to know so we can be all inclusive when we're entertaining things, so we don't make mistakes like putting them in a men versus women group or 100 other reasons why it's beneficial.
And then lastly, an ally is someone who supports equal civil rights, gender equality, social movement, social reform, and challenges fear and discrimination. And an ally can be someone on the LGBTQ spectrum. It could be someone who identifies as straight. It's just someone who supports these equal rights.
One minor thing I was going to point out is you see that the acronym for LGBTQIA has a plus at the end of it. And that's some of those other things that we just talked about, pansexual, demisexual. So if you didn't know.
Oh, yeah. The other thing is you can see the background here is the more recent pride flag, and it includes the pride flag from the 1990s, but it also includes the more recent, I think it's 2017 pride flag that includes the black and brown stripes for queer people of color, and especially those queer people of color who have died from HIV and AIDS. And it also includes an aspect of the trans flag to support those who identify as transgender. Oh, I want to make one more point about this. Sexual behavior does not equal sexual orientation, does not equal identity. So though all of those things are separate, and some of those things may or may not pertain to what services you provide. Also, as people come out as any of these identities, know that this is a process, and sometimes this process can be lifelong. Whether it's, you know, re-coming out to people, new people that they meet, or you know, coming out to, you know, family first or not family, depending on values, etc. But then also, you know, coming out to healthcare officials or safe people that are safest. So it's a process, and it's not like an on-off switch where one day you're in or closeted and the next day you're out. It's a process, and everybody's process looks different. Okay, we are going to talk about gender, and the flag in the background is the non-binary flag. And like I mentioned before, gender is this internalized state of man or woman, the spectrum of that or not on the spectrum. And identity is the internal aspect of it, or the psychological awareness. And expression is how do we communicate that through appearance and behavior. And you can see at the top, we have a bunch of genders listed here. Agender, no gender. Bigender is both. Cisgender means same. Cis means same. So, you're born a woman with the anatomical and biological characteristics of a woman, and your gender identity and gender expression is a woman. So it's the same. And then transgender is different. So born with potentially female biological characteristics, but identify as a male and express yourself as a male. That's transgender, different. Pangender is all genders. You identify as all genders all the time. I was scrolling through social media at one point, as one does, and I saw an individual who identified as bigender or pangender, and after working with their father, they were talking to their father, and the father says, well, do I have a daughter today or do I have a son today? And I think that just shows a lot of really good work when it comes to kind of explaining to others what gender means. And then you can have non-binary, which is someone who doesn't potentially sit on that male or female spectrum. And it can be shortened to NB, or it can be written out like this, NB. I do want to say that society has a gender normative lens that we see things through. And this tends to be cisgender heterosexual, meaning society or cultural expectations tend to have this idea that most people have the same gender and are heterosexual, meaning attracted to the opposite sex. Excuse me. And you will sometimes see this shortened as cishet. And it's important because if that becomes a cultural expectation, then that lens tends to disappear. We don't know that we're looking through that lens because that's the lens that we assume that everyone is looking through. And so that gender normative lens, that cishet lens, it becomes really important to notice that lens. So that way we can notice our implicit biases, engage in that reflection, and engage in that deep cultural awareness and cultural humility.
I was going to go back to that thought of having our person served trust us. All of our person served, that no matter how we work with them, kind of not looking through that cishet lens helps with that trust, helps build that rapport again with people. And again, it just goes back to that function and that meaningful. If something's meaningful, if someone knows that we're behind them, that we're not judging them or putting them in a box, in a different box than they feel like they should be in, just makes their therapy, their sessions, their treatment a lot easier for them.
Lastly, I do want to talk about drag. Drag is the act of performing a gender or performing as a different gender. It's usually done as the purposes of entertainment, but that doesn't necessarily mean that person wants to present as a different gender all the time or identifies as that gender. So you can have drag queens, which is someone who performs as a woman, or a drag king, someone who performs as a male. I want to dive a little bit more in depth into this transgender component. So again, transgender is someone who identifies different than the one that was assigned at birth. And you can see down below, ASAB, assigned sex at birth. You can be assigned female at birth, assigned male at birth. And then typically the nomenclature is female to male, or a transgender man, and then male to female, or a transgender woman. And like I mentioned before, this transition from one gender to another can include multiple steps, including a social step, coming out to those close to you. There can be a legal step, which includes changing your name and changing your sex on all sort of government issued IDs. And then also that last step, that medical step of getting gender affirmation surgery. want to stop here for a second, because there tends to be a lot of focus on this gender affirmation surgery. And just note that not a lot of people share this idea that they need surgery or they need medical interventions in order to have their external state match their internal state. Sometimes people get one surgery and not another one. Sometimes people just do hormone replacement therapy. Just know that each journey, each decision is individual based, and there are reasons potentially why they've done that. So just know that there's different components. Everybody's going to reach those components at different stages because of various reasons. I want to talk about dead name. And that's the birth name of a transgender person who has changed their name as part of the gender transition. So say a female was born Danielle Smith, and then she later transitions to a transgender man and comes out as David Smith. So his name is David Smith, and the old name Danielle Smith is considered the dead name. And it's very offensive to call people by their dead name. And we'll talk about that in a second.
Yeah, I've had interactions where we've had a transgender individual, and because paperwork reasons, it only gives male, female. So communication might be put out of, we know that this is what, we have to do it because it's this way, or it's the only way that's in this paperwork or documentation. So we'll call them Danielle, David in quotes. And that's like a nickname, and this person is identifying as David now, and we need to respect that fact. Not communicate out that, oh, well, this is just for legal documentation. We need to respect that fact and kind of look at using that dead name, or how else can we write that so it's apparent that this person identifies as David.
Lastly, I want to take a second to talk about pronouns. So the typical pronouns that we use are he and she, and that sits on that gender binary, right? Masculine and feminine. However, there's the gender neutral they. And you can see here that there's a lot of other pronouns that people can use to identify themselves. And using the appropriate pronouns is so important in terms of, that gender affirmation and creating a safe environment and understanding working with this population. A lot of people, so one way that you can show that you feel comfortable working this population is say like, hi, I'm Dr. Logeman. I use the pronouns she, her. And it can signal to others, that this is, I'm comfortable talking about this if it needs to come up for the things that we do. The other thing that I've seen a lot of people do is putting their pronouns in their email signature, which I think is really cool. And sometimes these are linked and it takes them to mypronouns.org, which then informs the reader, these are why pronouns are important and why I'm using these pronouns. Just spending a little more time on language. When I was talking with individuals at On With Life in preparation for the idea of language and using inclusive language is one of the themes that kind of came up the most often. And one of the ones that came up was, some people don't have husbands and wives. And so a more appropriate term would be spouse partner. So what does your spouse do? Or what does your partner do? I tend to prefer partner because people may not want to get married or identify as a spouse. And I feel it feels more equally yoked in the relationship using partner. And that can be in conversation. It can also be on forms, changing information from husband and wife to spouse partner.
That's what I was going to say when, again, most of us, I believe, that are probably viewing this webinar that helped put this webinar together, we're caregivers. We want to be inclusive. We didn't go in this to exclude individuals. We want people to feel the best, get the most out of their therapy or their treatment or their medical session. But this goes with our coworkers too. Mm-hmm. We work in collaboration with people all day long, and that same thought just goes with them. So this seems like a simple thing to do, but sometimes it's hard. If you've been used to, for 47 years, saying, who's your husband? Who are you married to? What's your wife's name? Sometimes that just systemic verbiage inside you is hard to break, but it's so meaningful when you can do it. Mm-hmm. When you can refer to someone as a partner or a spouse. It means the same exact thing. It's just using a different word. So I think it's so important.
I think that's an excellent point, because by first using spouse or partner, that opens up the conversation. Someone could say, well, my wife does. And then if they use the word wife, then you can use that kind of gives you permission to use the word wife as you go forward in conversation. So it opens up the conversation for them to then provide what information feels comfortable to them. So then you guys can have a more deep and meaningful connection, work relationship, or whatever the context is. Another one, instead of calling someone brother or sister, call them a sibling. Super easy. Instead of calling someone mom, dad, mother, father, you could call them parent, legal guardian. Also note that sometimes people don't live at home with two parents or two legal guardians. And so, if you're thinking about forms or whatever, making one mandatory, but then the second one optional. So that way you can allow for that, different permutations of families and all that.
Through the years, too, of working at On With Life, I found myself just kind of inherently referring to your support system.
Yeah.
Who's your support system? Because we see a lot of different people, and they don't always have the same support system that other people do.
The other thing is, some people might not be living with parents. They might be living with grandparents or aunts and uncles. And again, using this more general language initially, and then, hearing, even if they live with their biological aunt, they call them mom, following their lead in terms of what they call or how they denote that person, can really go a long way. Niece and nephew, you can call them the nibblings, which is like my new favorite word. I'm going to go visit my nibblings. It's fantastic. And then on forms or EMR systems or whatever, we tend to have this for when it comes to sex, it can be male or female, right? But so much is wrapped up into that. You can parse apart, biological sex versus gender identity versus gender expression. So one way to kind of help with this is to offer write-in boxes or offer multiple boxes that people select all that apply. Again, just for being more inclusive. Other surface interventions that we can do, again, offer more choices for gender, sexuality, partner status. We talked a little bit about this earlier, but the transgender name, this is how On With Life deals with the difference between their identity and their legal name. David Smith, and then we say legal name, Danielle Smith. We don't put it in quotes. Again, it's not a nickname, it's an identity. And then making sure the environment is set up to promote inclusivity, including gender non-conforming bathrooms or gender neutral bathrooms, flags, and advertising is LGBTQ plus friendly. Also celebrate diversity. The populations, these populations come with a wealth of knowledge and creativity and resilience and advocacy. And so celebrating that diversity and celebrating the value and expertise that people bring is so important too. That idea of being seen and being heard is probably one of the number of things that contribute to preventing burnout, is identifying that value and recognizing that value that people bring. We've had a lot of slides with a lot of different flags on them, and these are just some of the flags. There's so many of them. If you go, on this slide really quick, this is the straight ally flag. You can see the straight flag with the black and white stripes, and then the A in the rainbow pride flag. There's all of these different flags. There's even more here than what we even talked about. Yeah.
There's a lot of different ones.
So if you go to this website here at the bottom, Marie Claire, there's a bunch of different ones too. If you go on, if you support, queer small business artists on Etsy, there's a ton of flag stuff on there as well. And I really recommend you check it out. Support small queer local businesses. So we've talked a lot about that surface level things that you can do. Let's switch a little bit to that deep level, or that process, that incorporating content and process into your clinical work. Some quick examples of this is understanding cultural norms around drug use and sexuality. And so knowing that, certain populations may have to be screened more often for certain STIs or infections, and then also providing school-based counseling for anti-LGBT sentiments in school. So it's about taking that knowledge and incorporating that into the environment in which you need to work with. I love this article by Carmen coming from 2019, and it's cited at the end, and I highly recommend you go read it. It's a very quick read, but the big takeaway that comes at that deep level of working with an LGBT population is treating the person with dignity. And this is a huge concept at On With Life that permeates everything that we do, is treating the person with dignity. And so what comes with that is all of these things that people, LGBT populations, work with and encounter. And so I'm just going to go over this first one just for brevity's sake, but providers and clinicians come with knowledge and assumptions, right? So this is a quote from I think a cisgender lesbian who said that she had been sick for a year prior to the diagnosis, but her PCP thought it was anxiety, and so kept pushing anxiety medication. But then as a result, it turned out it was a large tumor in her chest. And because, this doctor knows that LGBTQ populations tend to have more mental health concerns, he was inappropriately attributing it to anxiety as opposed to potentially offering the full workup that maybe he would have offered somebody who was, cishet. So knowing those assumptions and treating people with dignity, to provide the utmost care.
I think, too, to refer back to several slides ago about the health disparities within this community, and also those percentages of how many younger kids than me in Gen Z are identifying as different genders or different sexes. And looking at this treating with dignity, that's going to come so much more to the forefront as a lot of people get older, as that community gets older. And so we can get rid of some of those health disparities within this population. It's hard to hear that some people just don't go to the doctor because they're afraid, they're worried that their doctor is going to judge them. Mm-hmm. Just that alone is hard to hear. So dignity should always be at the forefront of what we do.
Mm-hmm. This is a snapshot of a hospital's EMR system. And I think this is a great example of incorporating that deep cultural practice, incorporating what we know about transgendered individuals into our system, into our EMR system. And so you can see here, this is Dana, and SOGID stands for sexual orientation, gender identity. So it's being flagged as someone who potentially identifies on the spectrum. And you can see that they have their legal name and they have their pronouns, how they identify, but then also, the biological aspect of things. And I think that this is such a good step in a positive way of incorporating those things on a deep level. They're changing their system in order to better fit people, these transgender individuals. So we're going to bring it all together. So I am looking at this through the lens of a psychologist. So I'm going to just provide that caveat for a second. So when I work with somebody on the LGBTQ spectrum, I do all of the things here at the top that I need to do for everybody, which includes getting demographics, getting backgrounds. I assess the 4 or 5 Ps, depending on how you want to think about it: protective factors, perpetuating factors, precipitating, predisposing, and present factors. I assess all of those things, but then I also need to think about how what I do applies to this specific person because they identify with this population. So this includes gender and sexual identities. It includes the use of pronouns. It includes development and also the coming out process, where there are stressors involved with that, their trauma history, their degree of acceptance and affirmation by others. And then what stage of the coming out that they're in. So for an example, I'm a neuropsychologist, and so I use gendered norms, meaning I have a comparison for men and a comparison for women. Now, if someone's transgendered, which normative population do they fit in, right? And so understanding the current field, that this is a topic in the field of which gender to use when looking at that norms, is that deep level of using my semantic knowledge to better serve this person and making sure I'm providing the best care for them in order to provide the most appropriate diagnosis and then also interventions. And I want to hear Kim's perspective on this, because this is a psychologist lens. I want to hear Kim's RT lens.
My RT lens is a little smaller than the neuropsychologist lens, but I don't mean that in a bad way. Not that you don't need to know this stuff, but I look at it more as just kind of those basic functions. So what do you need to look for when you're planning an outing with a person in the LGBTQIA community? Do you have to look for those gender neutral bathrooms? Do you have to look at, are they still in the closet, but maybe not with you? Like, all of those things come into what you do, how we work with the person served. I think knowing their stage of coming out is very important. When you go back out into the community, when you're working with their families, so many of us work so deeply with families. Sometimes we work with LGBTQIA individuals that maybe are in our minimally responsive program, or maybe aren't cognitively aware. So it's good to have that, some of this knowledge if we can, so we can talk to their family. I think I really focus on that functional aspect of it. How do I make them feel comfortable to share things with me? How do I make them feel comfortable so they can get the most out of their therapy when they're with me? And if it's using the appropriate pronouns, if it's making sure our outings are to specific places with gender neutral bathrooms. On the other side of that, I try to do that with all my person served. Like, you don't feel comfortable going to a busy environment, I'm going to try not to take you to a busy environment all the time. So we do that inherently with all of our person served. But I think specifically with individuals in the LGBTQIA community, we talked about that oppression at the beginning, and it's been so hard for them that it seems weird that they have to fight to be accepted. Mm-hmm. And so I think that's why it's so important to help them do that. It doesn't have to be a big deal. It doesn't have to be this all-consuming thing to take up how you work with them on a daily basis. Does that make sense?
Yeah, I don't think maybe big deal is not the right word. It sounds like it's an intentional.
Yes.
Right. I'm being intentional in making sure I understand you as a person, and this is an aspect of you as a person.
Yeah. Instead of just relying on the fact that I'm a really caring individual. I put all my effort into making things person served centered, but I still sometimes miss stuff, and I don't want to miss it with this. And I think that probably everyone on this webinar doesn't want to miss it with moving forward with working with individuals.
Mm-hmm. Mm-hmm. One big thing of that deep level competence is things have got to happen at the systemic level. It can't just be person specific. In order to get real change, we have to get systemic change. And this is something that came out in the Joy Commission. And it essentially is a checklist for how to promote the community in your workplace. And it has checklists for leadership, including, are you implementing policies in a way that is inclusive of the LGBTQ community? How to set up a positive work environment. There's a section on provision and care treatment, how to set up front LGBT waiting rooms. For example, having magazines, like LGBT magazines, promotes a more safe and inclusive waiting room. Workforce. So having equal benefits across all staff. So it's not necessarily just the opposite gender that gets, health insurance, right? Your spouse or your partner getting, sharing benefits is just a very simple way. Educating staff, providing these types of webinars to your staff can be very helpful. There's a section on data collection and use, how to accurately collect data and how to store it, how to ensure communication that this information is being provided voluntarily when it is being provided voluntarily. And then also a section on patient, family, and community involvement. So I don't want to go into this in too much detail, but there are literal checklists that you can go through, and I highly recommend it. Common pitfalls and mistakes. So, looking at some of the questions in preparation for this, a lot of people were saying, what if I make a mistake? Or how do I correct myself? Or how do I correct somebody else? And I just want to talk about a few common things that can happen. And the first one is what we call virtue signaling, which is this very shallow act that shows others how woke you are, right? So I think of pride capitalism or pride consumerism, which is like all of these major corporations are kind of hopping on the pride bandwagon and selling pride merchandise when their money isn't necessarily going to supporting those things. And in fact, in some cases, it's actually going to prohibiting some of these laws going into place, right? So it's, you don't want to just throw a rainbow on yourself during the month of June. You want to support, you want to show support outside of the month of June. You want to do some more deep acts that show your support, whether that's how you use your money, how you use your time, those kinds of things. This is a very common pitfall that I see, especially in white women, is putting the burden of your education on someone else. So it's someone saying like, oh, that's so interesting. Can you tell me more about that? Or do you have a reading list? Or what do you recommend that I do to learn more about that? And it's not someone else's responsibility to educate you on these topics, right? We can listen to them and we can talk about their experience, but learning systemic oppression, learning the history, learning the pronouns, learning these things, that's on you. You need to engage in that self-reflection and engage in that self-critique and not rely on somebody who is already experiencing all of these oppressions and difficulties to then also burden them and show them why they're worth your respect.
I think that's a good point, and that is something that was hard for me to understand why that's a pitfall. Because initially I was kind of like, well, that's how I learned. They're going to tell me all about this, where I can still learn from that community and find places to go to so they can speak to me without asking them. Like, I can still research and find out those places all by myself. And I would say that's a common one, and I was a victim of that. Not a victim, but I did that commonly without even knowing.
Yeah.
Without even knowing that how that could come across.
Mm-hmm. We're so good about asking for homework,
mm-hmm.
right? We're so good. Yeah. Tell me more about that. What should I do? What should I read? And then following. So, you're putting the burden on someone else. And then especially if you don't follow through, like that burden is also like a virtual signaling. Well, what book should I read? And then not actually mm-hmm. reading it. Right. So, just being very careful about, asking, minority populations to help you in your education.
Mm-hmm.
One of the things that can also be a pitfall is using your own terminology, making up your own terminology, using non-affirming terminology or outdated terminology. I actually just read that homosexual is actually falling out of favor just because of the heavy past that's associated with it. And so using the more appropriate, like LGBTQ word is more appropriate than using the word homosexual. The other one is sex reassignment surgery or gender reassignment surgery. Well, we're not reassigning it. We're moving you more towards, an appropriate gender expression to match your gender identity. And so just continuing to be up to date on the terminology. Making assumptions rather than asking. Another pitfall is assuming because you identify as LGBT that you understand somebody else's experience. Again, this goes back to the watch what you're assuming and watch what you know and mm-hmm. Ask. And at the very least, practice opening up the door and then following their lead when it comes to certain topics and certain questions. Another common pitfall, especially in a healthcare facility, assuming that sexual orientation or identity are central to the problem of why they're seeing you. They might not be. Mm-hmm. So again, always ask that presenting problem, especially for psychologists, ask that presenting problem, and that might be a component of it. It might not be the driving force of it.
Yeah. I think of that too when outside of, or when you're working with individuals in sessions or outings or individual events, we're still treating for me, we're treating the brain injury or the stroke. I'm not treating them because they identify as non-binary. I need to know that to make their therapy more meaningful, but that's not why we're treating them. Mm-hmm. So still focusing on their diagnosis.
Mm-hmm. Presenting problem. Mm-hmm. Yeah. Lastly, this one can be challenging. Watch what you're asking the people, asking others, and also pay attention to what you're avoiding and what you're avoiding asking. A very common pitfall is becoming too curious. And when I was talking with somebody here at On With Life in preparation for this, one of the questions that they would ask generally by an older person is he was in a gay relationship, and so someone asked, well, who's the male and who's the female? And that's just not how it's not appropriate. It's not how gay relationships work. And so, also asking like, who's the top, who's the bottom, or, if it's a lesbian relationship, who's the man, who's the female, or how did you reproduce, or whatever. A good standard is if you're asking about sexual behavior, that's an inappropriate question unless you need it specifically for health related reasons, right? So sexual attraction, sexual orientation is one thing, but specific sexual behavior, specific sexual acts, not appropriate. Make sense?
Are you asking me?
Yeah, I'm asking you.
Totally makes sense. It does.
The other half of that is, are you avoiding talking about these things because of your own discomfort? That's important to be attuned to because that can also help you identify the lens that you're viewing things through. And if you are uncomfortable and avoiding it, then are you missing a key component that could be important in that person's interventions, treatment, care, quality of life? Okay, so we started this webinar saying this is not a one-stop shop. The work is not done just because you've come to see us. So this is not a destination. We're not reaching competence and getting that A and moving on. It's about knowing the baseline stuff, but then also continuing on this journey of cultural competence, especially as it's evolving through history and through events and politics and economics. And really focus on, we need the competence, but we also need the humility, the cultural humility. This is information taken from Dr. David Moser's blog on the IPA website, and I think it's phenomenal if you're a psychologist and you can access it. I highly recommend you go read it. But one of the points that he makes is, how do I make sense of all this contradictory information? And this can kind of come with some of the stuff that Kim and I talked about just the slide before. I'm telling to get educated on these issues, but I also shouldn't ask others for guidance. Like, that seems very contradictory of each other. And it has to do more of that process, right? That culturally deep understanding of the process, respect, power dynamics. So be very aware of microphone grabbing, which is a colloquial way of saying like making your voice louder than somebody else's voice that needs to be heard more. The other thing that, looking through and preparing for this, a lot of people say, well, what if I'm not good? What if I make a mistake? What if I offend someone? It's going to happen. Sorry. As we learn more through doing, we learn through more experience. You're going to make a mistake and you might offend somebody. Good news is we can talk about the art of the apology. Say the words, I'm sorry. That's very important. You have to say the words, I'm sorry. Then put into words what you're apologizing for and how it affected the person. And then describe what you've learned from this experience and how you're going to integrate it into your knowledge going forward. So, Kim, I'm sorry that I was late for our session today. I know that you have a lot of demands on your time, and I'm going to make sure I do better in the future, or something like that. So you have those three parts. The other thing is remember, your intention is not the same as your impact, right? And a lot of times people get defensive about their intention. I'm sorry, it wasn't my intention to do that. Mm-hmm. Your intention doesn't really matter because you've already offended the person. So really focus on the impact you've had on that person, on your behavior, and focus on the impact of what you're going to do in the future. Yeah. This is hard.
It is very hard. I think too, just that honesty of, I'm sorry. And like Dr. Logeman said earlier, going into this journey, if you're starting to become a better ally and starting to educate more about this, you're going to mess up. Just like that said, that's normal. We all mess up. And just having that honesty and the respect for yourself and the other individual to say that you're sorry, move on, figure out how to not use that word next time, or not use that presentation next time.
Mm-hmm. So what is the first step in your journey to becoming a better ally? Well, congrats. We're finishing it right now. It's about looking for those opportunities to engage in that cultural humility piece, looking for things that you can do to broaden your perspective, change your lens, such as reading lists, podcasts, conversations. I am a huge proponent of podcasts. keeping up on current events like bills being passed, engaging a lot of in that self-reflection, and then also asking and engaging with your organization to promote an inclusive work environment. While change on an individual level is important, it's also really important at a systemic level. And so we need that awareness, and we need those interventions across all levels of person interactions. Now, how do we respond to inappropriate comments made by others? That's more challenging because each situation is different, each person is different, each role is different. I did like this website that I found that said, use the 5 Ds, distract. So distract either the person who is making the inappropriate comments or the person who's on the brunt end of that. Delegate, find somebody in the system or organization that can help with the situation. Document, get your cell phone out. If authorities get involved, make sure you stick around and give a statement, do whatever you need to do to kind of document the situation. Delay. So this is a little bit of a misnomer. Delay means after the situation in private, kind of decompress and talk with a person. Hey, I saw that was really hard. Is there anything you need me to do? Or I saw that they called you, or they used the wrong gender or pronouns. I'm sorry that happened, kind of after the situation in private, making sure you decompress with that person. And then direct. This is the stepping in, the saying, hey, this is not appropriate, and providing kind of that direct intervention. I would just be a little bit careful about the direct one because we want to make sure we're not microphone grabbing again. And this is saying, if you're talking in a group of people saying, hey, that could be really offensive to so-and-so, that's not really an appropriate direct intervention. What might be more appropriate is, hey, I know you didn't mean for that to be hurtful, but if someone identified as X, Y, and Z, that could be hurtful. So it's not about a specific person in that group, but it's about just kind of the general kind of sentiment and appropriateness of comments.
Yeah, I think too, especially maybe more so taking that topic and thinking of when we're working directly with person served, or a patient or a resident, if one person served said something derogatory to another person served or another staff member, then that takes it even to another level of how to keep that other individual's dignity who said the inappropriate comment while educating and keeping the dignity of the other individual that maybe the comment was made to. So that is a challenge, and I think being open with your team, finding the best ways to address those things while still thinking of some of these topics, the 5 Ds that we just talked about, I think is something that you have to do. You have to be open to discussion about it, especially if it continues to happen and is hurtful to someone else.
Kim, it's like you knew it was coming up in our presentation. So how to respond to other people's inappropriate comments. These comments usually take us by surprise. They usually kind of come out of left field. And when that's the case, I'm going to slip into my psychologist mode for a second. It activates our fight, flight, freeze, or fawn response. And a lot of us freeze because it's like, I'm sorry, what? Like it doesn't usually register with us how to respond to that threat, right? And so what we can do, one way that we can do it is practice what we want to say in those situations. Practice it to the point that it becomes automatic. So when that fight, flight, freeze, or fawn response is activated, we can be like, oh no, I know what to say in this situation, and you don't have to think about it. This is something that I say to a lot of my colleagues that I work with, is it sounds really silly, but practice it. And you can see we have a couple of scripts here that we tend to send out pretty regularly to people at On With Life for inappropriate, like my favorite one is for the bottom one is for inappropriate comments like, Kim, I'm your psychologist. Our relationship is a professional one, and comments like that are not appropriate. Practice it, practice it, practice it. I don't know if you can think of any other scripts that kind of come off the top of your head.
No, I think those are two of the, or Allison, that is your hallmate. He lives across the hall for you. And I think that was a very inappropriate comment and could have hurt their feelings. Just kind of pointing that out, and it's not always going to work. It's not always going to work, and it's going to be hard. But I think showing commitment to helping maintain that is very important.
I do want to provide a little bit of a caveat that Kim and I both work with people with traumatic brain injury. Mm-hmm. And so we have to be, that's another lens that we're looking at things through. And so we tend to be a little bit more direct and a little bit more simplified in order to kind of accommodate the population that we work with. So know that these may not fit our entire audience that's joining us today, but those are just a couple examples that we have. And hopefully in the Q&A session, we can come up with more. Okay, we're going to wrap up this session with some resources. I love social media. If you have my number, I have sent you a TikTok. And I mean, only on TikTok can you come up with this just beautiful pun. At what temperature does gender fluid become gender solid? No one knows. But also, I think it's really important to surround yourself by people who have a positive impact and promote education about some of these social issues. So this is Finn, and they are a gender non-conforming individual who's been out as non-binary for over 10 years, and their TikTok is just filled with information about how to be a better ally. And one of my favorite videos of theirs is non-gendered makeup. Right. And so just like concepts like that maybe we don't think about every day. And I certainly am not going to think about, there's a lot of resources out there that come in many forms. And that's just one of them. I love Finn.
If you're new here.
And then this last one I follow So You Want to Talk About on Instagram. And they are a series. Each post is a series of 10 slides that talk about some of these more challenging topics, and it really boils it down into the main points and provides some statistics and how to think about how to, work with certain people and kind of help with identifying what's going on in that population. And I think, social media gets a lot of flack, but if you can find gold nuggets like these, I feel like it can really promote education, self-reflection, and that self-critique into your daily life in a way that is, it doesn't feel like a chore. So I really enjoy that. I don't know about you, Kim, but
yeah. Well, and I think that's all the information we gave you today is just one small piece of the puzzle, and it was a lot of information.
Yeah.
So I think if you can find these short, positive snippets on how to educate yourself, it breaks it down a little bit and it helps it not be so overwhelming.
Digestible.
Yeah.
Yes.
Because it feels like I can do this. I can do it, and maybe mess up a little bit along the way. But if I have to learn all of that before I work with a person served in the LGBTQIA community, I'm going to fall flat on my face before I start. So I think that even if you don't like social media, I do think that these are really positive because they're just in smaller pieces. Mm-hmm. I think that's really good.
Yeah, I agree. Lastly, here are some really good resources. It goes from general to specific to academic to very clearly not academic. And I think all are important because we need to be having these conversations on all platforms. I kind of really like the first one, which is from the HuffPost, which is Sex Ed for Grownups. And it's basically all the things that they should have taught you in sex ed class and they didn't. And it can range anywhere from topping and bottoming in gay relationships to how do you kind of come out as celibate to your partner. So really it covers a whole gamut of things. I like the Vox article for how to be a good ally. That's another good place to start. These are more general LGBT run organizations. There's a ton more out there. I got some information from the GMLA, which is the Gay Lesbian Medical Association, which right there. And then also the Lavender Health Project. I know we talked about the Red Scare at the beginning of the presentation today, and there was the Lavender Scare, which is this idea that LGBTQ people are a threat to national security. So Lavender Health is reclaiming that term for medical providers who identify as LGBT, but then also providing care for LGBT populations. And again, we talked about the Trevor Project and It Gets Better, the Joint Commission, and then again, we're really good about asking about our homework but not following up on it, so there's just reading lists everywhere. I found this Business Insider one, and it has both academic tests but then also novels, novellas, fiction, nonfiction work. So they're just everywhere out there. Just do a quick Google search and there you go.
I think those reading lists are not only important when we're thinking of educating ourselves, but they're also good to know when we're working with certain persons served that might be asking us, not knowing what we don't know, and they might be asking us for resources too. So it's another good way. I was going to comment when we were preparing for this that I really liked the Vox article about how to be a good ally. I thought that was a good one.
Mm-hmm. Okay, and then we have our sources, and we made it. Thank you so much.
You guys, thank you so much for hanging with us and listening to some of the stuff that we had to say, and we look forward to answering your questions in the Q&A. Thank you.
Hi, everybody. I'm going to stop my screen share. And I have Dr. Logeman and Kim with me here, and we're going to do our live Q&A. So I'm going to open it up first. First, I'm going to say thank you to Kim and Dr. Logeman. They did such a good job. I learned so much. And as they were in here with me while I was watching it, and we've already written down several follow-ups and questions and things that we're going to start implementing here as a result of this. So I hope you found a couple nuggets that you can take back to your practices as well. So first and foremost, we do have some questions that were pre-submitted, but I want to make sure we open it up to you. Use the chat, use the Q&A if you have questions that these guys can answer. If the presentation brought up a few, hey, can you clarify this? Or what do you think about this? They're here to answer them. So I'm going to give you guys a few minutes to do that. But first, kind of I don't know if it's an easy one or not, but a short one. How do I encourage change within my organization without getting really intense pushback from coworkers or administration or HR or anyone? How do I start? Where's some place I can start with encouraging change?
So the first place I would start is looking at what can I do in my behavior, in my practice, and I'm lucky enough where I have an office, what I can do in my office in order to signal or incorporate working culturally competently with different populations. And so whether that be a flag or introducing myself, hey, my name is Dr. Logeman, I use she, her pronouns, looking at what I can do for my own personal practice. If you're looking at organizational change, you're going to get pushback just because change is really challenging. We're coming up against a lot of years of policies in place that you have to kind of look at with a new lens. But start with small changes. And we had talked about, pronouns in your email signature, including gender neutral bathrooms, including things in the waiting room, starting with those small changes. And then again, looking at that joint commission and looking at what policies could you be putting in place? Are we making sure that our policies and procedures are inclusive with this lens in mind?
I would just add to just constantly educating yourself, maybe not setting out to educate your whole organization or corporation yet, just kind of starting in that small bubble and go with really functional ways that's going to impact your staff. If it's going to be a benefit to half of your staff to make these changes, then we should make them. So it's just go with really good functional examples and reasons why they should make some changes. It's not going to happen overnight, and it's not going to probably be easy. So keep educating yourself.
Going along with that, I find that if one person can have a competency in a specific area, that one person becomes an expert, a go-to person, and having that person as competent as a resource is a really good way to then start the domino effect of change. And so feeding off of what Kim said, making sure that you have the competency and the lens in order to help other people within your organization.
And I think having you as our expert has really been helpful for us because you've also created a safe place where we can come and ask questions and say, hey, I'm not sure if I'm going to say this right, but here's my question. Help me out. What's the best way for me to take the next step in this? We did get a question about wanting to watch this again, or if you had to jump off early and you weren't able to watch all of it. We are going to put it on our YouTube channel. We'll link on our Facebook page as well, because we know this is good information that people are going to want to share out.
You're good. Your hands.
Okay, So I thought this was a really interesting question that was submitted. Again, if you've got questions, give them to us in the chat. But here at On With Life, we work with a lot of adult individuals who have had a traumatic brain injury, stroke, other neurological condition, sometimes may have had cognitive effects.
Mm-hmm. Change in personality, change
Yep.
in their filter.
Filter, that's a great word. What advice do you guys have for staff who are out in the community working with adults with a TBI or something, adult patients, when they say something inappropriate or a hate-filled comment to an individual with the LGBTQIA+ community?
That's good.
Yeah.
It's probably happened through the years when we've been out and about. And I think the slide we talked about, saying I'm sorry, is a big one. And then redirecting, try to educate a little bit, but we know our person served have choices and preferences and opinions before we work with them. We talked about treating the person served. We may not treat their bias or non-bias while they're here. But I think the apology would be my go-to in the community, and having the courage to do that, because comments like that can be embarrassing, even as the most seasoned therapist. So, or caregiver. I think apologies go a long way.
I think it's important to think about the person that you're with and the context that you're in,
Yes.
and the purpose of why you're with that person, right? If you're with that person to examine why they have those values, then yes, it's important to kind of delve in. Where is that coming from? What is that origin? Is that helpful, or is that helpful or hurting this situation? The other thing is, if that's a comment made in passing, you can say, you have your own values. That's not why we're here. Let's go and do something else. That redirection. Because sometimes it's just not possible to address that head on. Another way that you can say it is, those values those aren't the values of On With Life. We ask that you don't express those or share those in the hall, in public spaces around the hallway or something like that. So it can be very short. It can be very to the point. Yeah. If you're not used to being direct, it can feel aggressive. And just because it is direct doesn't mean it is aggressive. Again, practice it is really important. And then practice not only the stopping, but also the redirecting, because you need both. You need both pieces.
Yeah.
I love that practice piece. Some role playing in between.
Yes.
Hey Kim, I'm going to practice this on you because this feels really aggressive for me, and I'm not used to being that direct with someone. Yeah. So let me try it on you, and then being able to get that feedback too. Of hey, let's try it this way, or this next question: politics, religion, and homosexuality are hot topics. While we say don't talk about politics or religion at work, it comes up. It comes up in natural conversations. What can we do to create a welcoming environment that people can respectfully share their views and empathize with differing ones?
Wow.
That's
it's an exercise in empathy, which I think that's an expectation, it's a differing expectation of everyone. Not everyone is going to be capable of that level of empathy. And again, it goes back to that context and that person that you're with. I don't know.
I would also just kind of echo that. I would never expect a coworker or an organization to judge me because I'm heterosexual and married to a man. And so I would expect those same things for individuals that identify differently than I do. I'd like to say it's common sense for me. I know that's not a term that should be generalized for that type of topic, but I would never expect that. So I don't see it as homosexuality coming up at work more so. That's what it is. That's this person served, or this coworker or person served identifies differently, and that's what it is. Kind of doesn't have to be a huge topic, in my opinion.
But it can.
But it is.
It can be a discussion, because
yes,
there can be discussions where you and I may not agree on something, but there can still be a discussion in passing or in short. I think and what the person I wonder if is asking too, of how do you create a space where those conversations can be had here at work, versus just saying, hard line at the door. We're not going to talk about religion, politics, homosexuality, any of that stuff.
When I do hot topic button issues, I always start off with a couple of ground rules, which can seem infantilizing people, but it's really not. You know, a couple of those ground rules could be, you know, when I talk about sex and sexuality with younger people, it's, you know, don't yuck my yum. There's one microphone. We value reflective listening and active listening, and we understand that others are coming from a different perspective. And so setting those ground rules at the beginning, even though it's not a typical social convention, if those conversations are important to you, what you're doing, moving the company, moving yourself, moving your community in a different direction, setting those ground rules to optimize respect and construct a constructive conversation, that would be super important as well.
Yeah. This next question: as someone who identifies as transgender, I have the privilege of working for a company that is more open-minded than most and was supportive when I came out, which I think is fantastic. What can we do to help non-gender conforming individuals not fear losing their job if they come out at work?
Oh, I find this question so challenging because, you know, I feel lucky enough to work at a place that values difference, expertise, that values, you know, everyone coming from a different perspective. And so I'm having a really hard time imagining, you know, the fear of losing your job just because of who you are. So, you know, I think one of the big things to emphasize again is that it starts at the policy and organizational level, making sure those things are inclusive.
Mm-hmm. I like too, Allison, what you said earlier about starting with yourself. Mm-hmm. I really believe if you can create a safe space for one person, that will hopefully start to flow into that. So I think creating that safe space. I also think it's helpful for leadership staff to be in that same space. So yeah.
I think
that's a hard one.
It is a hard one. So much dignity and respect is communicated in language. And so making sure the foundation that you lay for communicating to others and about yourself starts in that language, and understanding, you know, if you don't identify on the LGBTQIA spectrum, you know, understanding that language is important in conveying not only how much you respect that person, but it also conveys, you know, I do have some comfort in working with people that identify on that spectrum. So I think, you know, language, policies, procedures, those are really, really good places to start implementing change.
And I think too, having, you know, watching something like this, learning from others and having leadership learn from others. I know we had a couple folks go through some extensive training on diversity and inclusion, but that's not, I mean, it didn't just stop there.
No.
I mean, you can't just stop with the training and stop with one webinar. It's a continuing conversation as we learn more and as we grow and things like that.
Yeah, my background's in recreation therapy. Yay for the shout out for rec therapy. But I went to that diversity training at DMU, and I went into it thinking this is going to be beneficial, but I'm really good at being inclusive, and I learned I'm not good at being inclusive, and there was so much more I needed to educate on myself, and it kind of started me down a passion to figuring it out and educating and learning more. So
we have one more question that was submitted that we're going to ask. This is your last call. If you've got other questions that you want to hear our team answer, now's your chance. But I think this was a good carryover from what you were talking about. How do we approach changing the heteronormative verbiage in the workplace? What education needs to be done, and how do we hold ourselves accountable? Which I thought was really interesting, the accountability part.
Yeah,
I'll let you go first.
I think the reason we're laughing is we were kind of having a conversation about this offline, where it's like, you know, having the passion and having the expertise is one point, but having that carryover and that implementing change is a whole nother skill set. And so we were talking about, you know, we want to do more things that are inclusive of different populations, different gender identities, different sexual orientations and expressions. But how do we do that in a way that makes people feel safe to do that we can keep track of it so things don't fall off by the wayside, or we're not having job creep where we're just adding things to people's plates kind of inappropriately. And then how do we do it in a way that we actually follow through with it? And one of the ways that we kind of came up with that is having kind of a central person, which we've alluded to a little bit, and having that one person has competencies in this, can keep track of all the other things and know how to disseminate information and kind of checking up on things. One of the things that we do is we have a lot of different disciplines have different eyes on things. So like, we have a bunch of forms for intake, and I've put eyes on it, social workers put eyes on it. Having a lot of different people putting eyes on it with all of their different lenses can be a really good way to check and make sure for inclusivity, checking that heteronormative lens that we have. It can be holding people accountable, can be offering an opportunity for more learning when it comes to those things. And so I think that that's one good way of having a lot of different eyes on things, having that one central person with expertise and being able to disseminate and implement that information.
Yeah, good answer.
We had a couple more comments. Words are wonderful, but what about actions? And I think we talked a little bit about that, about, those small steps of find something that is within your area that you can change and start there. Start with those actions.
I do want to add to that.
Go ahead. I was going to add something.
I want to add is that it's, it's really, for me, I find it very hard to talk about actions being a psychologist, and we have a very wide audience, and it's hard for me to say, okay, as a speech language pathologist, you need to do X, or a physical therapist, you need to do X. But, looking at, I think time and attention are also very valuable resources. And so how do you spend your time and resources as actions? How do you, when you use your money, are you promoting small business owners? Are you promoting a small queer business owner using, just on a personal level? That's a really good place to start, I think.
I kind of lost my train of thought. I got lost in your answer. So we'll move on. We're running pretty far over. So
how do I approach the EMR issues of not being inclusive or is it even accessible for LGBTQ plus clients?
We have this very same problem.
That's a lot bigger than just us starting in our bubble.
Yeah.
There's so many processes and workflows that go into making sure the EMR works for you. And so it's a lot harder to make changes within the EMR. We found as we've implemented some new ones that could have changes even now.
Yeah. And it's hard because a lot of times EMR systems are systems you've paid for that may or may not have the capability of doing the things that you need to do to be inclusive. So start there. Start by looking at what EMR system you have and are paying for, and if they have those options to do that, updates or whatever. But then also be looking at company specific things, like what are the company specific things that we can have for being more inclusive. One thing that I tend to do, because our EMR is not as inclusive as I think it could be, is in the narrative portion of my note is I tend to correct what I can, and I use appropriate pronouns and I use appropriate names. And if I don't have that opportunity in my click buttons or whatever, then I just make sure that is very explicitly addressed in the body of my note.
And you gave a good example of the legal name versus the dead name of how to note that and document that. That was going to be my answer too in writing notes, is investigate what's going on, talk to your IT department or your EMR team if you have that. See if this is on their radar. If it's not, put it on their radar if we do updates or get new programs. And then add it to the narrative.
Okay, we are going to do one final question. If an LGBTQ person brings their partner to a corporate event, will there be acceptance from all, or will there be snide remarks? How will upper management handle that?
Oh, that sounds very company specific. I think the best thing that you can do, we talked about in the presentation, is use as general and as inclusive vocabulary as you can, and then allow them to kind of fill in how they want their partner or their spouse or whomever to be addressed. And just being a role model for that is, one of the best things that you can do. And not only it's a good role model for then upper management, but then also for colleagues, but then also it's ultimately treating that person with the utmost dignity and respect.
Thank you.
Thank you guys.
Thank you.
Thank you guys for listening.
We are going to be sending out a survey, which inadvertently was the link I sent you for the webinar. My sincerest apologies. Please fill out the survey. We'd love to hear, if there's more topics you'd like to hear Dr. Lilderman and Kim talk about. you know, we're still growing and learning as an organization too, but these two are a plethora of knowledge when it comes to things like this and have taught us so much already that we're excited to share some of that with you. So if there's specific topics or questions we didn't get answered that you think that you'd love to hear us address more in a webinar, let us know. And watch
Abby,
soon.
can I jump in? Sorry. I noticed some comments that maybe people weren't able to watch the whole thing. Will they be able to have a link or something?
Yes.
If you guys request it,
Yes.
Maybe put a link to the
Yes.
full thing.
Yep.
Okay, thank you.
We are going to send out, since this was a free webinar, we're going to send it out to all of you that you can rewatch it, share with others. We'll put it on our YouTube channel so you can share it easily, but we are happy to share our expertise with whoever wants to listen to it.
We'd welcome other questions after the fact too. So just reach out to us. Thank you.
Thanks everybody. Have a great day.
Thank you.